Hi, everybody. I'm Roland Regino. Welcome to the Kind Intel podcast, where we explore how innovative solutions and compassionate leaders are transforming healthcare operations. Join us as we talk with industry experts who are redefining efficiency, elevating patient experiences, and are shaping the future of care. On today's episode, we welcome Varuna Trivedi from Beam Vet Care in Seattle, Washington. Thanks for joining me today. Before we dive in, could you give us a quick overview of your background and current role?
Yeah, thanks for having me. I'm excited to dive in. So currently I work for Beam Vet Care. We are a veterinary practice, and we are a two-location small business, privately owned, non-corporate in the Seattle, Washington area. And we are primarily a small animal hospital seeing canine feline species, but we've recently expanded into the exotic vertical, and now we're seeing exotic species. So it's all been really exciting. We've also undergone a rebrand or a name change. I'm a clinical director there, overseeing both clinics and sort of business operations around them.
Thank you, Varuna. And we'll have to circle back to that exotic verticals segment of your patient population. That sounds interesting. But in terms of the operations of your practice, what initially inspired you and the current patient flow system across your clinics?
Sure. So I think we've now come to a workflow that works for us, but we've gone through multiple iterations of it, right? I think it's just trial and error to see, where your bottlenecks lie and what's causing delays in your workflow, why you're not able to turn patients out every 30 minutes. And so right now we see appointments every 30 minutes. We typically have 2 or 3 doctors on staff and 1 technician appointment column. Lean Six Sigma principles to identify bottlenecks and redundancies in our workflows, and I can give you a few examples of how we've applied those. When you typically walk into your doctor's office, the normal flow is you check in with reception and then some time waiting in the lobby until an assistant can bring you back into the exam room. And then the assistant brings you back into the exam room and takes a brief history of, the reason for the visit. And the doctor comes in and goes over treatment options, and then you check out with reception. So we used value stream mapping to sort of map our client journey from intake to discharge, and we recognized some redundancies in the process. There were a lot of wait times, whether that was waiting in the room to get checked in, to waiting for the doctor to come in, and also some information overlap that was being exchanged from the client to the assistant during that history process, and then overlapping information that was being relayed again to the doctor when the doctor went in, right? So we found pockets in that 30-minute appointment workflow where we could maybe tweak and make us more efficient to reduce our clinic time. And so we moved to self-check-in and online bookings. That's taken away from reception, and so clients can book their appointments online, they confirm it, so that's reduced our no-show rate. To then using smart templates so that our assistants are getting the relevant information that's needed during that history process, so there's no overlap or information osmosis between the assistant and the doctor, and our assistants are trained to get relevant information as well. So I think making those changes and using lean tools has been really beneficial in helping improve our workflows, and that's really worked today, where we're able to have the doctors in and out and reduced any burden or overtime from our providers, and we're able to squeeze in an additional 1 or 2 appointments that walk in through our doors because we're staying on time and on track. And I think, something as basic, it doesn't have to be, applying lean principles or having all that knowledge and information. I think something as basic as looking at your exam room setup and making sure you have procedure ready kits or organized supply carts. You can use something as basic as the fact you set up, you sort out your instrumentation, and then have your exam room set up sustainably so there's reduced time between trying to find instruments, and just stay organized, especially during those peak times or those rush hour where time is of the essence. So just working smarter, I think, with coordinated workflows has really helped team efficiency.
For that. I think you already touched on it, but I was really interested. It's a very methodical approach, and I was wondering about those peak times. And so it sounds like you're saying to prep as much as possible and to leverage some of those systems that you had discussed. Obviously, the self check-in, online booking. Are there any other technologies that you leverage in order to help your clinics run?
Yeah, I mean, we're huge on technology. I think it's an accelerant, if anything, to our workflows. And so, especially during those peak times and to manage that, our reception is trained to send out digital forms through our practice management software so that we are able to reduce time in the rooms and get in as much information as we can ahead of time, reducing that intake time or taking history. So these forms are typically sent via text or email, and we get that information ahead of time, which has been absolutely game changing. We also leverage telehealth when we can, especially when we have to squeeze in appointments during those peak times. And I think telehealth was prolific during COVID, but I think it's here to stay. And it's really opened up or freed up appointment slots for more complex cases. And we triage, simple cases that may just need medication refills or symptoms that can be maybe relayed virtually. And then it's as simple as sending a prescription to their pharmacies. And then lastly, I think team-based care is one of our main approaches in our practices, where we leverage our medical assistants and vet assistants to do most of the heavy lifting for our providers. So they are trained in reviewing charts, reviewing medication, doing a lot of heavy lifting in terms of educational sort of firefighting and answering any questions that the clients may have in the room. So that cuts down the doctor's time coming in and allows them more time to see another appointment or two.
Comes to measuring success in your operations then, given all of these methodologies that you employ, what key metrics do you focus on? What numbers really tell you if things are working well?
Yeah, so I geek out on KPIs, right? And I look at both medical and financial KPIs. I think they're not mutually exclusive, right? I think if one trends upwards, the other kind of automatically will trend upwards. If you are delivering high quality patient care, that translates into financials trending upwards as well. The money will kind of just follow. And so on the medical side, I like tracking more quality indicators, treatment compliance rates, client satisfaction, whether that's through Google reviews or getting feedback through any internal platforms that you may use. And then on the financial standpoint, in dentistry, would track hygiene retention. How often are, your patients coming in and have a booked appointment for their next teeth cleaning? Because that gives us a good snapshot of the health of the practice and patient compliance. And in vet med, I'm tracking average client transactions, average patient transactions, the treatment plan compliance rates. I really enjoy tracking through our P&Ls monthly where our final EBITDA lands after taking out our payroll costs and our inventory costs and I guess cost of goods sold to see what's trending upwards and what's trending more flat or down, because that's going to tell you a story month over month as to what changed. If your inventory cost went down, did we give lesser number of vaccinations, or did that mean we had lesser number of wellness appointments that were seen that month, right? So it's just looking at those numbers and backtracking to figure out what caused that change.
And before the call, we had mentioned briefly that your clinic had gone through a reorg and a rebranding. And so I'm curious, as you had mentioned some of those KPIs, were there any specific KPIs that you found critical before expanding to these new locations?
I think your profit loss statement and your balance sheet are the two big ones to kind of determine the health of your practice. We've been in practice now for about 10, 12 years, right? We had our first location set up in 2012 and the second one in 2015. The opportunity just came through for our second location to expand from a 2,000 to a 5,000 square foot facility. And so going from 4 exam room practice to an 11 exam room practice. And then we also had an opportunity to hire an exotics doctor. So adding on another vertical to offer those services. Things just, played out to allow for a rebrand, a reorg, and an expansion altogether. I think looking at your KPIs, looking at what would be the next line of or stream of revenue for you, and if you can roll out some equity and allow for expansion, I think that is one big metric that will allow you to look at, as a clinician, can I expand to another location? Can I expand one of my current locations? Can I add on another associate? Can I add on another vertical? I think my practice owner was at that point where he's like, what is next for the company? We've recently gone through a rebrand, just looking at monetary and financial status, but also doing a little bit of market research to see where the veterinary industry is going, and given all the corporatization around us, I think for him, he said, I can beat the corporates and continue to stay profitable looking at our EBITDA. And so that's basically what caused, the reorg. And we're really excited for all the changes that are to come because it only means growth from here.
Speaking of growth, when you're looking at those clinics and the different sizes, especially in terms of patient volume and revenue, does the size of the clinic influence your operational decisions? For example, do you have different systems for clinics managing 1,000 patients monthly versus smaller locations?
Yeah, so I'd say one of our locations is definitely smaller than the other, and it really plays into the expansion that we've gone through, right? My second clinic is larger, has about 11 exam rooms compared to the first one, which has 5 exam rooms. And one of the biggest challenges for us is consistently providing high quality, right? How do you maintain that when you continue to grow, and how do you provide that consistent delivery of care? Because both clinics pretty much function the same way. They share centralized leadership, shared protocols. We share the same practice management software system. So there is exchange of medical record keeping and clients flowing from one practice to another because we also share staff. So the doctors do work out of both locations. So there is continuity of care if a client is seen at one location, but tomorrow is seen at another location. So I think one of our biggest challenges is trying to deliver consistent standard of care. And I don't think the size of the practice matters because when a client is walking through your doors, they're walking under one roof. They're not walking in to see Dr. A or Dr. B. Unfortunately, the way at least veterinary medicine and dentistry today with the newer generation is trending is the newer generation looks at healthcare services overall from a consumer lens of convenience and not so much provider centric around merit, right? I don't think any of us, even in my generation, are calling around for a specific doctor. We're looking at a convenient location next to me and hey, I just need my teeth cleaned or my pet needs vaccines. What's the closest vaccine clinic or veterinarian? It's not ideal from a provider standpoint to commoditize the industry, in my opinion. Unfortunately, dentists do want to establish a client base and want to be seen off of merit, but I think the trend is trending towards more of a convenience consumer lens type of mindset. And so we just have to adapt and stay consistent because, like I said, clients aren't walking through our doors to see a Dr. A or Dr. B unless it's a complicated case and they're being followed through. A lot of our clients walk through our doors saying, hey, my pet just needs vaccines, and I'm happy to see any doctor. And so we've been working really hard in trying to deliver consistent care, whether that's through leadership meetings, one-on-ones, consistent training of staff, or having space for real conversations, honestly. Like, what are our challenges? Let's meet, monthly and talk about it and work through our workflows to make this easier for you. So consistency has definitely been hard, but we've been working through some modalities that has been helping our clinic.
Thank you. And then looking at healthcare more broadly, I think you touched on this a little bit, but what does the true scalability look like in this industry, healthcare industry in general? What are the unique challenges and opportunities in terms of scalability?
Yeah. So, I can talk to healthcare, dental and veterinary because that's where my experience has primarily laid. And if I had to rewind the tapes back to, say, 2017, 2018, 2019, we saw a ton of private equity-backed enterprise-level DSOs come to a rise. And I think what factored into the rise of these PE-backed groups was the low cost of capital, huge access to debt at low interest rates, and so we saw a lot of these dentists wanting to consolidate, and then we saw a ton of recaps come through in 2017, 2018, 2019, and some of those recaps were 9 or 10 times cash on cash return. And so come COVID, we had all of these little, investor groups coming up and trying to convince dentists to sell practices or consolidate during the COVID boom, saying you are going to sort of see some equity churn out on the next recap. And fast forward to today's economic market where, the smaller PE groups are now trying to shake hands with, say, national level consolidators to make an exit and see some type of return. They're seeing very little to no return on their equity, only because in today's economic market where interest rates are through the roof, it's no different than, trying to buy a house 10 years ago at a 2% interest rate mortgage to then fast forward today you try to refinance and you're paying upwards of 7%, right? So I don't think that was accounted for. And in vet med, especially during COVID, we saw a boom in pet adoptions, right? People had disposable income, so they were adopting pets and they were spending all that money in veterinary businesses. So we saw inflated numbers when it came to valuations on practices because they were churning out that type of revenue. And today we are definitely seeing a slowdown in revenue. We're seeing a slowdown in market. We're seeing shelters overflowing with pets and adoption rates dropping. So it's a different market, I think. And so scalability has that challenge today with rising interest rates, economic downturn. And so I think the mergers and acquisitions momentum has slowed down a little bit, which obviously plays into slower scalability on the private equity side, right? And so that we have that challenge ahead of us. I think there's opportunity with that for the smaller groups, say like individual 2 or 3 doctors wanting to come together and emerge as their own consolidators, or their smaller sort of private equity backed groups with their own funding. So there's opportunity for those mid-career dentists or mid-career veterinarians who are like, hey, I want to expand into a 2, 3, 4 location and maybe grow from there into a 10 location by partnering with a colleague of mine so that we can actually make a brand for ourselves. So there's definitely opportunity with that, but I think the M&A market and the momentum has slowed down. And we'll see where that goes with the economic market today, but I think we have some challenge ahead of us.
Speaking of those challenges, what are some of the biggest operational hurdles you've had to overcome, and how did you approach solving it?
Yeah, so I think overall, industry-wide, whether it's dentistry or vet med, I think delivering high-quality care while balancing and running a lean, sustainable business has been one of the biggest operational challenges, right? My practice owner is always like, we have to hit a certain EBITDA, but we do not want to compromise on patient care. And I think this problem is multifaceted. There's a bunch of layers that make this a complex juggling act, right? So when I'm tasked with, I want to run a sustainable business, but I do not want to compromise on care. The only way I can make that happen is if I have the right team, the right staff. I have operationals and scheduling integrity where there's no holes in our schedule, there's no errors in booking, clients are being communicated to the team. And then, there's the revenue cycle management of it. We're getting paid, whether that's through insurances or client pays that service, right? So there's all of these layers when it comes to running a smooth operation. And I think dentistry and vet med are seeing a ton of, since COVID, I think, or even pre-pandemic, staffing challenges, right? It's hard to retain, acquire, and maintain top talent. I think if you can lower your staff attrition and retain your staff, that plays into consistent delivery of care and helps with clear communication and, operational workflows sort of running smoothly at the practice. On the scheduling front, on the client side, if you have scheduling integrity, you're able to optimize your schedule, have a doctor, a solid schedule that's booked optimally, that's not causing sort of any hurdles or overburdening the staff with overflows and overbookings, then, that's when that plays into a smooth sailing sort of ship. And so there's all of these challenges. And then if you tag on to that technological integration, I think healthcare is the last, field to jump on technological bandwagons. I think we're the last to adopt any technologies. I mean, we still have pharmacies using the fax machine, right? So we have to take into account technology. And I think with the lack of integration that we have, given that we have cloud-based practice management softwares, but then we have digital X-rays, and then we have a two-way client communication, which is a separate platform. We have so many platforms that we juggle, and if they don't speak to one another, we're seeing some type of pitfalls through, missed communication to clients or scheduling errors, right? So I think a few challenges alongside, technology, and then, like I mentioned, staffing challenges and scheduling challenges. Balancing all of that and making sure we're running a tight ship has been one of my biggest challenges.
As follow up to that, something you mentioned, why do you think it is that the healthcare industry is one of the slowest to adopt new technologies?
I think we're the last ones to adopt it only because we like to do things the way we're just creatures of habit, right? So if something's working, why fix it? If something's not broken, why fix it? And I think continued to have used paper charts for the longest time until we were able to adopt, say, practice management softwares or, traditional x-rays to then today's digitized x-rays. So we get there, but it just takes us a while. I think things are changing now, especially with us being able to adopt AI, even though it's slower and obviously not being, I guess, used at the level that it can help us and has the capabilities, but we've started to adopt it on a basic level of, say, transcribing our notes and allowing, that to get translated in the medical records, which is taking away from our doctors' time trying to keep up with medical record keeping and allowing them FaceTime with the clients in the room. And they're seeing value in that now. So I think until a provider or clinician sees value in technology, they are slow to adopt it. And I think just the busy pace of our day to day, I think providers are already swamped. And so we're just trying to get through the days, get through the motions. And so to take time outside of our day to look at newer technologies and, play with it and allow for that trial and error to see what's working and not, we just don't have the bandwidth for it, I think.
I'm waiting for that fax machine to get phased out, but it doesn't seem like it's going to happen anytime soon.
Yes.
Looking forward, aside from that fax machine phasing out, how do you see vet operations evolving over the next few years? What changes do you think the practices need to prepare for?
Yeah. So I'm just going to reference back to, mentioning the newer generation and commoditizing the industry. I think that's here to stay. So if you are able to provide convenience and transparency to your clients, I think that's where practices are going to thrive. So, if you are able to give online scheduling, because I don't think this generation wants to pick up the phone and make, an appointment. So if you can digitize that in any way, whether that's through text messaging or allowing for online booking in your schedule, that is one change I think everybody needs to jump on, because we should be able to provide that convenience to our clients, right? I think AI is going to be a huge catalyst in any practice, and so if you are able to adopt that, I'd say it's going to be a game changer, because it's going to take time away from your provider spending time trying to keep up with records and allow them that enhanced client experience, spending time with patients, answering more questions, or maybe even able to squeeze in a few more appointments in their schedule versus spending time making their notes. So if you can allow for AI in that sense, but also in VetMed, we've leveraged AI on the lab testing front, right? So we have an AI microscope in our practices called the Imagist. And we run a ton of lab tests through that. And the turnaround time on testing is as quick as a few minutes, right? So if you put in a urine sample in the AI microscope, it runs it and lets you know what the urine analysis would look like, what levels are we seeing with that. And it's, been pretty accurate. We've done sort of lab tests where we've sent the same sample to our lab and then we've run it on the AI microscope, and the tests have come pretty much, apples to apples. And so we're able to give those test results back to our clients sometimes while they're in the building within that 30-minute appointment, and draft up the diagnosis and send them home with medication. And that's converted patients with client compliance and allowed them I guess greater patient satisfaction, because now they're not waiting for 24 hours for lab tests to come around and then for medications to be refilled or the doctor to review and give them a call. So I think AI has been revolutionary in just reducing the time consumption around a lot of redundancies in medicine, and just speeded up the process. And I think that's to the benefit not only to the patient but also the doctors.
And I was going to ask how long a traditional lab test takes, and it sounds like you said 24 hours, but that's 24 hours until they find out about it, and then they decide whether to come back in person or call the clinic and then start all over. Whereas the AI lab tests, sounds like it's a few minutes and you can decide right then and there. And so it
Exactly.
really, really does speed things up. That's interesting. Any other innovative approaches or emerging trends in vet care that you're excited about? It sounds like the emergence of AI. Any other specific tools or changes that you're thinking of?
I think telehealth, it's not a COVID era change. I think it's here to stay. And just touching on the exotic vertical that we expanded into, right? A lot of these species coming through our doors really only need to be seen on a case by case basis, or, when they're really sick. And so I can cite an example of where telehealth was game changing for us. Was we had a client who lived about an hour away from us and had an axolotl, and the axolotl was extremely sick, and the vet recommended that we do a virtual visit And because the drive alone with temperature regulation could kill this pet, right? An hour drive in the summer heat could have, been detrimental. And so we triaged this patient, did a virtual visit, sent some medications to their pharmacy, and I guess the pet's thriving today, and they didn't even need to come through our doors. And what plays a little bit into this is a little bit of leeway with legality around veterinary medicine. It's not as, I guess, regulated. Maybe human medicine would have some regulations around, that doctor patient establishing care physically. But because vet med has few looser regulations around, there's no HIPAA compliance, for example, that we were able to leverage telehealth and really, help this pet out. And so I think that's definitely been one that's been game changing, and we're excited to see it develop and grow as we continue to grow and see more species through our doors.
Does sound like there are a lot of changes coming up in the vet care world, and especially if they implement some of these technologies and practices that you've implemented in your clinic. It does sound very exciting. This has been extremely insightful. I know we're running out of time, but before we wrap up, I just want to ask if there's anything else you'd like to share with our audience about operational excellence in your vet practice.
For sure. I think, we're already struggling with so many challenges as managers on the floor, right, when it comes to operational excellency. I think what I've learned, and one of the biggest takeaways from my career so far, is that feedback goes both ways. Just because, you are a leader or you are sitting at the top of the food chain doesn't mean you kind of know how things are working on the floor, right? So yes, you give feedback to your employees on like a quarterly or, 6 months or an annual, whatever your flow is. But as a leader, it's important to get feedback back. So I'm constantly sending out surveys or polls to my team saying, hey, we've rolled out this change. Is it working? Is it not? I want to hear from you because you are actually on the floor utilizing the tools or doing the task at hand. And if there are any hiccups, I would like to know about it so we can tweak it and change it, and just being open to change and continue to stay curious. I think the day that I stop asking questions and stop trying to improve our workflows is the day that I don't think I'm going to have any passion and want to continue working. And so stay curious, ask questions, see what you can iterate and change to your workflows, because I think operations are dynamic. They're constantly changing and evolving, especially with, addition of technologies.
Thank you so much, Varuna. I'd like to thank you again for joining this podcast. Your passion and insight and your practices that you've implemented have been extremely helpful to our viewers. So thanks again. And with that, we'll wrap up the show. Thanks very much for listening to the Kind Intel podcast, and we will catch you next time. Thank you, Varuna. And this again was Varuna Trivedi from the Beam Vet Care in Seattle, Washington. We'll see you next time. Take care, everyone.
Thank you.